5FC, that is flucytosine, is a narrow spectrum antifung or fungistatic, active against Cryptococcus neoformans. Okay, and chromoblastomyces, these are active against this type of fungal infection. And flucytosine is not employed as a sole therapy except occasionally in chromoblastomycosis. Okay, then imidazole. You have to write only the classification, and about the classified drugs you shortly write it. Okay, the mechanism of action and uses, adverse effect, etc. Imidazole and triazoles. Okay, there are presently the most extensively used antifungal drugs. The imidazoles and triazoles are most extensively used antifungal drugs. 4 imidazoles are entirely topical, while ketoconazole is used both orally and topically. Ketoconazole is used orally and topically. Okay, 2 triazoles, fluconazole and itraconazole, have largely replaced ketoconazole. Ketoconazole is replaced by fluconazole and itraconazole for systemic mycosis because of greater efficacy. The imidazoles and triazoles have broad spectrum antifungal activity. Okay, the imidazoles and triazoles have broad spectrum antifungal activity and covering dermatophytes, candida, other fungi involved in deep mycosis. Okay, all type of fungal infection, any type of fungal infection or all type of fungal infections are treated by triazoles and imidazoles and triazoles. Fluconazole, itraconazole and ketoconazole is the both orally and topically used. Okay, only ketoconazole. The mechanism of action of imidazole and triazole is the same. Imidazole and triazole, the mechanism is same. Okay, both imidazole and triazole have same mechanism of action against fungal infection. And what is the mechanism of action? They inhibit the fungal cytochrome P450 enzyme. Only you have to write this. This is the one sentence. This is only one sentence. Both imidazole and triazole inhibit the fungal cytochrome P450 enzyme. This is the enzyme. Okay. Lanosterol 14 demethylase, that is known as the fungal cytochrome 450 enzyme. Name is Lanosterol 14 demethylase. You have to write this. Lanosterol 14 demethylase is the fungal cytochrome P450 enzyme. This enzyme is inhibited by both imidazoles and triazoles and thus impair the ergosterol synthesis. Ergosterol is an important part of fungal cell membrane. The synthesis of ergosterol will be inhibited by fungal cytochrome P450 enzyme inhibition, that is known as Lanosterol 14 demethylase. Okay. The lower host toxicity of triazole compared to imidazole has corrected with their lower affinity for mammalian CYP450 enzymes. This is not important. Then development of fungal resistance to azoles has been noted among candida infecting advanced AIDS patients. Okay. Then clotrimazole. It is effective in the topical treatment of tinea infection like ringworm. 60 to 100% cure rates are reported with 2 to 4 weeks application on a twice daily schedule. Okay, clotrimazole. Okay. A 7-day course is generally used for oropharyngeal candidiasis. Oropharyngeal. The mouth infection is pharynx and oral fungal infection. At the pharynx and mouth fungal infection, देखिए ये सब पड़ा उड़ा white पड़ी तो that is known as fungal infection. oral fungal infection, oropharyngeal candidiasis, 10 mg of clotrimazole is allowed to dissolve in the mouth 3 to 4 times a day, or the lotion gel is applied in the mouth for as long as possible. Clotrimazole is well tolerated by most patients. Local irritation with stinging and burning sensation occur in some part. When you apply clotrimazole lotion, it has very irritating action. You both pude jole, yes. Then iconazole, miconazole, all these are belongs to same. Irritation after cutaneous application is infrequent. Then ketoconazole. It is a fast, orally effective, broad spectrum antifungal drug. If the clotrimazole is ineffective, by the help of clotrimazole, if the treatment is not success, then ketoconazole has been used. It is the fast, orally effective, broad spectrum antifungal drug. All these are clotrimazole is available in a topical application, means lotion, liniment, cream. The clotrimazole is not available in oral form, but the ketoconazole is available in oral form. We can take it in tablet and capsule form. Okay. It is the fast, orally effective, broad spectrum antifungal drug useful in both dermatophytosis and deep mycosis in the deep fungal infection. Okay, the oral absorption of ketoconazole is facilitated by gastric acidity because it is more soluble at lower pH. In the acidic medium, the absorption of ketoconazole is more. Okay. Hepatic metabolism is extensive. Metabolites are extended in urine and feces. Elimination of ketoconazole is dose dependent. Okay. Then adverse effect, ketoconazole is much less toxic than amphotericin B. AMB, that is amphotericin B. Ketoconazole is much less toxic. If we administer amphotericin B and ketoconazole has very less toxic effect, but more side effect occur than with itraconazole and fluconazole. Okay, but when we compare with itraconazole and fluconazole, the ketoconazole has more side effects. Then interactions of ketoconazole with other drugs. What is drug-drug interaction? When two or more drugs are given simultaneously, any type of adverse reaction or unwanted reaction is known as adverse drug reaction. Okay, ketoconazole, it is the most stable azole. Interact with several drugs due consideration must be given. Okay, H2 blockers. What are H2 blockers? H2, ranitidine, famotidine, cimetidine. These are H2 blockers. Proton pump inhibitors, omeprazole, pantoprazole, and antacid decrease oral absorption of ketoconazole by reducing the gastric acidity. Okay, it has been described a few moments before that ketoconazole is readily absorbable in acidic medium. But when we simultaneously use ketoconazole with any type of antacids like H2 receptor antagonist, omeprazole or proton pump inhibitor, then it will reduce the absorption of ketoconazole. That's why during the administration of ketoconazole, we should not use any type of antacid that is like H2 receptor antagonist or proton pump inhibitor. Then rifampin, phenobarbital, carbamazepine and phenytoin reduce the ketoconazole metabolism, reduce its efficacy. These are rifampin is antitubercular drug and phenobarbital. What is phenobarbital? Barbiturates, sedative and hypnotics, and carbamazepine, that is antipsychotic drug or H2 receptor antagonist also. Carbamazepine, no, only it is a antipsychotic drug. And phenytoin, anti-epileptic drug. Phenytoin, hydantoin, it belongs to hydantoin, induce the ketoconazole metabolism and reduce its efficacy. If we simultaneously use ketoconazole with this type of drug, the metabolism of ketoconazole will be enhanced. Okay, it will induce the ketoconazole metabolism and reduce its efficacy. The efficacy of ketoconazole will be reduced because the metabolism will be enhanced during the simultaneous administration of these drugs with ketoconazole. Okay, ketoconazole inhibits CYP450 enzymes, especially CYP3A4, CYP2C9, CYP2C19, and raises the blood level of several drugs including phenytoin, digoxin, carbamazepine, omeprazole, diazepam, cycloserine, cyclosporine, haloperidol, nifedipine, and other cardiovascular drugs, warfarin, okay, sulfonylurea. Sulfonylurea is what? Anti-diabetic drug. Okay, ketoconazole inhibits this enzyme, especially this, and raises the blood level of several drugs. When simultaneous administration of ketoconazole with this drug, it will increase the blood concentration, raises the blood concentration of this drug, because ketoconazole inhibits this enzyme, and if there will be inhibition of enzyme in the liver, then the metabolism will be reduced. If there will be reduced metabolism, then the drug concentration in the blood will be rises, especially to this type of drugs. Okay. Then orally administered ketoconazole is effective in dermatophytosis because it is concentrated in the stratum corneum. Okay, it is a muscle layer. Okay, orally administered ketoconazole is effective in dermatophytosis because it is concentrated in the stratum corneum. Okay, by topical application it can be cured, and by oral administration of ketoconazole, the deep fungal infection may be cured or will be cured. Finally, we discuss about fluconazole. It is most important for your examination point of view. You have to write about fluconazole. You write anything or not, but you should have to write fluconazole. This is the most important antifungal drugs. Okay, it is a water soluble triazole. It belongs to triazole, and it is water soluble, having wider range of activity than ketoconazole. Indicates include cryptococcal meningitis, systemic and mucosal candidiasis in both normal and immunocompromised patients. Immunocompromised, the patients who are suffering from AIDS, they are immunocompromised. Okay, less immunity. Fluconazole is 94% absorbed. Oral bioavailability is not affected by food or gastric pH. The ketoconazole is affected by gastric pH. At low pH it will be absorbed. If the pH will be raised, then there is no absorption or reduced absorption of ketoconazole. But in case of fluconazole, these difficulties are overcome. Okay. Fungicidal concentration are achieved in nails also. If there is nail infection, there is no blood circulation or less blood circulation in nails because they are dead cells. But the fluconazole concentration also in the nails also. Okay, produce fluconazole concentration are achieved in nails, vagina, and saliva. Okay, and this area fungal infection will be treated by the application of fluconazole. Okay. And adverse effect, fluconazole produces fewer side effects, mostly nausea, vomiting, abdominal pain, rash, and headache. Incidence of severity of these side effects increases with dose and duration of therapy. Okay, these are minor adverse effects: nausea, vomiting, abdominal pain, rash, headache. Okay, if we increase the dose or if you increase the duration of action of duration of therapy of fluconazole, these side effects may increase. Okay, selectivity for fungal cytochrome P450 is higher, like ketoconazole. It does not inhibit the steroid synthesis in men. Okay. Use fluconazole can be administered orally as well as intravenous in severe infection. Orally or intravenous we may use. A single 150 milligram oral dose can cure vaginal candidiasis with few relapses. Relapses means come back, again come back. Okay, but the cases are very few. It will terminate the infection. In many cases it will terminate the infection, but in some cases it can be relapse. Okay. Oral fluconazole 100 mg per day for 2 weeks is highly effective in oropharyngeal candidiasis, but is reserved for cases not responding to topical antifungals. Fluconazole 100 mg per day for 2 to 3 weeks is the first line treatment for Candida esophagus. In the esophagus, the Candida infection is there, and the fluconazole 100 mg per day for 2 to 3 weeks, it may be fruitful. These are the different uses of fluconazole. This is all about your antifungal drugs. Tolnaflat, you read it. Then antiviral drugs. Antiviral. Ajit Tiwari.